Joined over the phone to tell us more about what's happening there is Dr. Islam Anan, a professor of health policy and health economics. Good afternoon to you, sir. President al-Sisi directed to provide aspects of health support to the people in the Gaza Strip. What are the most important ways that the Ministry of Health has supported the Palestinians in Gaza?
That's a good point to start with. So, as you mentioned exactly, and what we are witnessing in Gaza and Palestine in general is actually catastrophic from healthcare perspective. And when we say catastrophic, it's actually the definition of the WHO as well on what's happening from the infrastructure. Egypt and President Abdel Fattah al-Sisi have been pushing for a deal with the occupation troops for almost a month now to get aid delivered to Gaza, to the people there, and to be able to help all the injured and the people crossing the borders to get their treatment inside the hospitals in Rafah.
Yes.
And actually, we are talking about more than, unfortunately, 10,000 deaths now in Gaza, and maybe like 40% of them are children and women, which is
a disaster.
Yes, it's a disgrace to the global community, actually. So I would take this even opportunity to make my deep condolences to all the Palestinian families. But what we are trying to do, and Egypt has been the first country to support the injured and the patient in actually the stress of having their medications, even for the chronic diseases like diabetes and hypertension. And it's very important to mention that in Rafah Hospital, it's been equipped since the 7th of October with what's needed from resources perspective, and mainly for the children. And even we are talking about 5,000 women, pregnant women in Gaza that will be needing a delivery soon, especially that when we say catastrophic in the hospital, we are talking about 50% of the hospitals in Gaza are currently being bombarded by the occupation troops.
As you said, sir, that the situation when it comes to the healthcare system in Gaza is catastrophic. In fact, the Ministry of Health there had described it as a complete collapse of the healthcare system. Given the large tens of thousands of injured within the Gaza Strip, in addition to patients who require care, such as cancer patients, or as you said, women who are waiting to deliver. How can the Egyptian side further help? I mean, obviously, there are obstacles when it comes to sending in aid and also receiving these patients. What else could the Ministry of Health provide?
So if we are talking about the aid that Ministry of Health can do, we are talking about two dimensions. First one is what can we actually offer for the patients crossing the borders in Rafah, and what will be the aid that needs to be delivered inside Gaza. For the hospitals themselves, we need to make sure, and that's what's actually happening, that we do have for the neonatal care for all the neonates and newly born children. And for women specifically suffering from any comorbidities or complications during their pregnancy, and the emergency services for the injured and for the old people who are actually were crossing. You know that every month there's hundreds of patients who regularly were actually crossing borders to get their treatment, to ensure that we do have their medications ready for their chronic conditions. That's in Rafah, and to be delivered inside Gaza, there is a need of a lot of vaccines for children who are in need, and that's what Ministry of Health have driven. And His Excellency Dr. Khaled Abdel has actually mentioned that we are sending polio vaccines, which is very important for all the children that are not vaccinated. We are as well witnessing, as you mentioned, a catastrophic in terms of infrastructure, so there is no vaccines for children, and maybe, and I hope not, we are expecting some diseases to evolve that we need to take care of, which is like typhoid, cholera, dysentery. So we need as well.
Sir, do you think that given the situation when it comes to a lot of different things like sanitation and the fact that the healthcare system is generally collapsed, that there is a real possibility of an outbreak of disease within the Gaza Strip?
Yes, exactly. And we hope not, but usually when there is a war zone or a conflict zone, and there is a lack of good sanitation and fresh water, we see cases for cholera, dysentery, and as well because of corpse that's still in the streets, unfortunately, and we've seen horrified pictures. There's as well a lot of diseases that can be transmitted from the dead bodies to the people of Gaza. So we need, unfortunately, to say that we need bags because there is lack of bags for the corpses in Gaza. So we have to bury them with specific precautions for the medical aid and for the medical professions there.
Sir, there were, during the press release, actually in the press release, they spoke about doctors in the quarantine zone within the Rafah crossing, where they had examined patients, especially foreign nationals, and they checked on them. This procedure, why is it necessary to send them into quarantine first and have them examined there? Is there a real threat of possible diseases, for instance, or are they getting them vaccinated? What's the situation?
So from health policy perspective, this is a normal routine step that you need to do in all war zones and conflict zones, that you need to make a triage first. So to make sure that there is no chemical war or a chemical substance, and we know that white phosphorus were used by the Zionist occupying troops against the Palestinians. And we need to make sure as well that there is no any infectious disease, because as we were mentioning, during war zone and conflict, there is a high possibility of viruses and bacteria to be nourishing there. Yes. And another point is to make sure that they are taking the necessary vaccination if we are talking about children, and especially the polio vaccination. So that whenever we are starting the treatment plan for all the injured, we are making sure that we are starting from the right point, and we are not actually missing any infectious disease or missing any step that's needed for treatment.
Sir, what about as we spoke, like other than the injured and the dead from the war there in Gaza, there are patients who are treated for chronic diseases or illnesses like we're saying, diabetes and so forth, but there's more serious diseases like cancer treatment patients. Could we expect these patients coming in as well through the Gaza or the Rafah crossing?
That's an important point, and we need as well to tell the audience that was normal even before the bombarding on Gaza, that people of Gaza were crossing the borders to take their treatment, and specifically we're talking about dialysis and cancer treatment. And currently, because of the collapse of the healthcare system, there is no medications. And as we all the time say that the Zionist troops are bombarding and there is not humanitarian, it's not humanitarian from the perspective of war. But again, I guess it's forcing them that as well there is no treatment or medications inside the hospital. So it's very important, and that's what the Minister of Health is doing to equip the hospitals in Rafah with chronic medications, mainly for dialysis, cardiovascular diseases, and the cancer, as you mentioned.
Sir, also the doctors there in the Gaza Strip had spoke about, as you were saying, that there's a deep need for medication in general. And specifically, one of the things that was worrisome was the fact that they were saying they are out of anesthesia, and sometimes they have to perform amputations, for instance, without any form of anesthesia to knock the patient out. Can Egypt start to send these products, or is it still something that is blockaded? As you know, sir, that the Israeli side has enforced the idea of checking these goods and making sure that certain products that they don't want are not allowed to enter.
Yes, all the ER and operating rooms equipment are necessary to be there in Gaza. And as we were mentioning, the brink of collapse of all the hospitals. Sometimes it's lack of gas and energy, and sometimes because of the bombarding, there's a specific need to run field hospitals there. And that, I guess, the most important thing is to open the borders for the healthcare professionals to cross to provide aid and medical aid the Gaza Strip and for the Palestinian people. And if we can allow, and unfortunately that we cannot do it for all the injured all the time in one day, for example, but at least as much possible of the people in need to the operating procedures to cross and do it in Rafah Hospital and then return back to Gaza Strip.
Okay, Dr. Islam Anan, a professor of health policy and health economics, thank you so much for joining us over the phone. We're going to